Dr. Aaron Beck is a psychiatrist at the University of Pennsylvania. He developed in the early 60s, he developed cognitive therapy, which is one of the, basically if you hear that psychotherapy is effective for depression, anxiety, the research that's done around that is primarily around cognitive therapy or cognitive behavioral therapy. So it was a big shift that occurred from sort of the movements like psychoanalysis, that sort of thing, and moved it towards a cognitive therapy. So what Dr. Aaron Beck says, is it's unfortunate that depression is considered a mood disorder. He says in reality it's more of a thought disorder. Now what does that mean? He's not saying that people that are depressed have psychosis or are out of touch with reality. What he's saying is the way we perceive something or interpret something influences how we feel about it. For example, if I am cut off in traffic by a red Mustang by a young driver, and I have to slam on my brakes and the adrenaline goes shooting through my body, that sort of thing. If I interpret that this is a reckless driver that doesn't care about my safety and puts my life in danger, it might cause me to feel angry, and that feeling and that emotion can then lead to a behavior like honking your horn or yelling out the window, that sort of thing. So the way I interpret a situation, I interpret the red driver cuts me off, and I interpret it that he's intentionally putting my life in danger. That will then lead to the feeling of anger, fear, obviously, but then also maybe anger. And then the thoughts and the feelings together will influence how I behave. Now, if we take the same situation, the red Ford Mustang cuts me off, I slam on my brakes and my heart starts pounding, that sort of thing. However, when I'm about to honk my horn, I look over and I see that a 5-year-old child chased their ball into the road and the Ford Mustang just barely swerved to avoid the child, right? All of a sudden, now I might reinterpret that situation and say, wow, I'm glad that he swerved and didn't hit and possibly kill the child, and I no longer interpret that as he's reckless and that he's looking to endanger my life. So, and that interpretation of that same event, same Ford Mustang cutting me off, will influence how I feel, and then together how I think and feel will influence how I behave. So that's one of the basic concepts. How I perceive, interpret a situation, how I think about it, influences how I feel. Together, how I think and feel about something influences how I behave.